Why are Americans supplying 2/3 of the world's blood plasma? They need the cash. In 2019 alone, plasma companies paid about $2.7 billion for Americans' donations.
I feel like I'm helping somebody and they helping me out.
I'm glad that it does help people, but I only found out about it because it pays you money, and I only find myself doing it when I need money.
While donors make about $50 per donation, a liter of plasma is worth over $200 on the open market. So why is plasma so expensive? When Liz Savage and her husband first started donating plasma in college, the earnings doubled their monthly income.
$400 goes a long way when you're a broke student.
Now she uses the money to help out with expenses, like buying her kids new school clothes. She visits a center near Baltimore, Maryland, twice a week.
I've tried DoorDash, I've tried, little things here and there, but this is consistent. There is a need for it.
Plasma makes up more than half of blood volume. Hospitals use it in transfusions to treat burns, liver failure, and more recently, COVID-19. But plasma is also used to create drugs that are some of the most expensive a patient can buy. To make medicine, companies break down plasma into its protein components, such as antibodies. But plasma is over 90% water, so removing enough proteins to treat just one patient for a year takes between 130 and 1,300 donations. That's led to a boom in private donation centers, where donors are paid an average of $35 to $65 a visit. That means if you donate the maximum of 104 times a year, you can earn more than $6,000. Donating plasma takes 9 times longer than a typical blood donation, but it brings in 3 times more plasma than just removing plasma from a blood donation. And because the human body replenishes plasma within 48 hours, Americans are allowed to give up to twice a week. That's compared to 8 weeks between each blood donation. Regular donors can make extra cash through referral bonuses, holiday giveaways, and rewards programs.
This is the gold, silver, platinum. Past 35 days for a donation, you can redeem the points. Keep you coming back. That's marketing right there.
On social media, I've already been getting ads saying, be a founding member of the center. You can get $700 a month.
Annalidi Sochoa lives near a new plasma center in Ypsilanti, Michigan. She's a social science researcher who's tracking the rise in for-profit plasma centers.
Since the Great Recession, the amount of plasma donations has roughly tripled to 2019 levels.
There are over 900 private plasma centers across the U.S., mostly owned by 3 companies that control 2/3 of the global plasma industry.
We compensate donors for their time and their commitment to the program. Their money is placed on a debit card, they can get gas, they can go grocery shopping, so it's very convenient.
Researchers like Ochoa say these centers are often concentrated in states with lower minimum wages and cities with more people living under the poverty line.
These areas are being targeted because these are the areas where people who are most in need of income live.
One study of plasma donors in Cleveland found that more than half were unemployed. 57% said at least 1/3 of their income that month was coming from donating plasma.
I'm the only one working, so with 2 kids, you gotta make up the money somehow.
Regular donors told Insider they spend their money on gas, rent, phone bills, food, and student loans. In the 90 minutes it takes to donate, they can make 5 times the federal minimum wage.
I kind of figured into my budget now.
The need for it is only growing. Each year, global demand for plasma-based drugs is rising 6 to 8%. Analysts say the market for them could near $50 billion by 2027. That's double what the world spends on bath soap each year. Running a plasma center isn't cheap. A single plasma extraction machine costs an average of $50,000, so equipment alone can cost $4 million per center. Plasma companies spend over half of their operating expenses on just the collection and manufacturing of the plasma itself, That huge investment drives up the cost of the drugs.
It's about $4,000 to $5,000 out of pocket. And there have been times where I have had to, I've taken out loans.
Christina Brown was diagnosed with primary immunodeficiency as a college student. She says that year she was in and out of the hospital with 15 urinary tract infections, 5 bouts of bronchitis, and 2 cases of pneumonia. Now every week, Christina self-administers 100 milliliters of a plasma-derived drug into the layer of tissue on her abdomen. That's a lot of liquid. A patient with diabetes usually injects less than 1 milliliter of insulin at a time.
I'm able to have a life and to be alive.
These drugs are therapies, not cures. So people like Christina rely on them for the rest of their lives, and they can cost over $200,000 a year. The pandemic could make these already high prices rise even further. Global plasma collections were down 15% in 2020 because of social distancing, cleaning requirements, and fewer donors visiting centers.
I'm kind of starting to stock up on doses now. I'm getting refills the day that I can get a refill.
And patients will feel the impacts of that in the next 7 to 12 months, the time it takes for plasma to go from a donor to the drugstore shelf.
It's pretty terrifying.
This is all while plasma is in high demand as antibody transfusions show promising results in treating COVID-19. And private companies are collecting plasma from COVID patients to develop drugs.
There is no country in the world that is self-sufficient in plasma for plasma therapies unless it pays donors.
Compensating donors has proven to increase supply. In the Czech Republic, paid donations were legalized in 2008, and donations increased 7-fold in 3 years. In Europe, the countries that bring in the most plasma per capita are the ones that pay. Even in places like Italy, where donors get a paid day off work, supply doesn't meet demand. Whereas Germany, which allows paid donation, collects even more plasma than it needs. America has more lenient policies than other countries, including those that pay for plasma. The only other place that lets donors give as frequently is Canada, where paid donations are only legal in certain provinces. That's why the US system is so large, efficient, and lucrative, and why some countries decide it's just cheaper to import plasma from America. But there isn't much research on the health effects of donating plasma 104 times a year, the US legal limit.
Your veins start to hurt after so long, you gotta switch arms back and forth.
The more often people donate plasma, the lower their protein levels are. So frequent visits mean each donation brings in less and less of the components needed to make drugs.
Our concern is that people who are vulnerable are giving their plasma to make ends meet, and we don't actually know what the long-term repercussions of this is.